What we know is that for decades, Australians including significant numbers of Western Australians, have been reporting chronic and debilitating symptoms that are quite complex, and that they have been attributing these to ticks. What we do know is that the people who are experiencing this illness are caught in a catch-22 because of the complexities surrounding the ability to diagnose, as well as the differing approaches that are taken, because there is no data that's been collected. Because of the lack of data regarding the numbers of people who've been affected, it's been considered to be less urgent to try to find a solution. So what we are finding is that people who are incredibly unwell are being turned away without a proper diagnosis, and often being told, far too often, that there's simply nothing that can be done, and that they can't get the support that they need. Now, there are many terrible stories of the suffering that has resulted from this particular syndrome, and sadly, we do know that there are some people who have suffered and who have subsequently died by suicide because of the extent of their sense of hopelessness and because of the crippling effects of their illness. So the establishment of the Senate inquiry was a big step forward towards validating the experiences of thousands of Australians, and acknowledging that there are massive gaps in the understanding and the subsequent treatment of these complexes. So there's no doubt that we have a vexed conundrum, but one that we can't continue to put into the too hard basket. 1,260 people made submissions in one form or other to the inquiry. It is clear that too many people are being let down by the health system. So the recommendations made by the Senate Committee represent a good start, and we in Western Australia must ensure that the West Australian experience is included in the research, and that our government is augmenting the work done federally through our state agencies to best support those who are being affected.